My name is Keith Nabb, and I'm the owner of Affordable Medicare Solutions. We're Georgia's largest Medicare planning agency. We've been in Gwinnett County for 26 years, and I teach all over North Georgia. I teach nurses, social workers, case managers, skilled nursing workers, as well as families on how to deal with Medicare, because there's a problem. Our federal government used to send out people to teach on this subject, and they've had cutbacks. So my agency has filled that need around Atlanta for quite some time now, about a total of 13, 14 years of teaching around 1,200 classes. So this is something I enjoy, but I understand that it is confusing. So we have lots of different flyers that'll be available to you, as well as other materials that you'll be able to download and follow along with from the video links. So let's get started. Preparing for your aging parents. You probably never thought you were going to be taking care of both your children and your parents at the same time, but this is a common fact today, and we call this the sandwich generation. But I have to tell you some compliance things. I do not work for the government. I don't work for Medicare. We do this as a public service, and all of the information that you wanted to get from the federal websites are great at Medicare.gov. Never go to Medicare.com. They'll try to sell you something. Go to Medicare.gov. No plan names, company names, or prices or anything like that will be talked about today. What we're doing today is to learn education, learn materials so that you can be empowered to be able to make the proper decisions for yourself. First, let's understand how Medicare has changed. Medicare was created in 1965, and it finally started changing in 2005. Medicare has come a long way. So that's 16 years ago, and Medicare wanted to make sure that people had options to improve their health care and not mandatory choices. So Medicare Advantage is a system that was created in 2005, and you may have heard it advertised on TV lately where they say, get your extra Medicare benefits. Well, also the prescription drug program for Medicare was created in 2005. And that program has been unbelievably popular. And think about this, there was not any drug coverage for seniors until 2005. Can you imagine that? People were paying for their drugs completely out of their pocket, or if they had a retirement plan, they might have had some help. So with all of these changes comes confusion, because the more choices you have, the more confusion that they can sow, and you'll definitely be hammered with advertising all day long in October and November each year. But with confusion also comes this opportunity for vulnerable seniors to be taken advantage of. And this is a major problem, and Medicare knows this, that seniors are not always given the full information to be able to make a proper decision. Education will empower you to solve these problems. So let's talk about this traditional Medicare that was created in 1965 versus the modernized side of Medicare, which was created in 2005. And this is where people right off the bat get confused, but it's really not too difficult if you understand a few small things. Medigap plans, which are Medicare little insurance policies, were created in the 1970s because Medicare did not cover everything. And the Medicare gap insurance policies were created by insurance companies to fill in the gaps of Medicare. Well, these little policies were created all over the United States by different insurance companies, and they were crazy. So the government came in the 1980s and standardized these policies to make it very simple for you to compare one company versus another company. And they're coded by letter codes. So if your mother or father has a Plan F and you shop for a new Plan F or a new Plan G, you know that between one company to the next company, there will be no difference. It'll be identical between the plans. The premiums may be quite a bit different, but the plan coverage will be the same. And typically, these plans have no pre-existing condition issues when you are applying at age 65. After age 65, when you go to shop for buying a new plan for your parents, they can ask you questions about the person's health. Not every state does it that way, but Georgia does. And so you will answer health questions, except in certain specific circumstances. such as guaranteed issue. What guaranteed issue means is maybe you've lost other coverage. You've lost your employer coverage, you've lost your retiree coverage, or you've moved. Your parent has moved from Tennessee to come live with you in Gwinnett County, and they've lost other coverage because of the move. In those circumstances, that's called guaranteed issue, which means you won't have to worry about any health questions, and that's the ideal moment to improve your situation during that transition. Now, these plans under traditional Medicare have either low or no deductibles. The most evil, hated thing in all of health insurance is deductible. Matter of fact, you could probably become president of the United States by saying, I'm going to get rid of your deductibles. Well, that's what happens under Medicare, is that people do not have $7,000 or $8,000 deductibles like they do under healthcare. They might have a $0 deductible or $200 or $300 deductible. Very small financial risk on traditional Medicare using these miniature insurance policies called Medicare supplements or Medigap plans. Now, you can also move these plans or shop these plans and find new ones anytime during the year. So if your parent moves in June, you can get a new plan in June. Some of Medicare requires you to wait till the end of the year, but Medigap insurance policies, you can change those any month of the year that you choose to. Very important that people understand that, because a lot of times people think they have to wait till the end of the year, and that's when it's crazy, when lots of things are happening under Medicare, and it's very difficult to get things done at the end of the year sometimes. So let's talk about this. Let's go back on this side called the Medicare Advantage plans. These are the plans that were created in 2005. And these plans were an attempt by the government to modernize Medicare. So we call these modern Medicare programs. Medicare calls them health plans. So when you talk under Medicare, they say this is a Medicare health plan, which means it looks at your health care in total versus traditional Medicare in a different format. So these Medicare Advantage programs are modernized parts of Medicare, but you can also notice that they use networks such as an HMO or a PPO. This is very similar to what you have when you're employed. If you're working, you or your spouse has insurance at your work, they'll probably have a network for you to choose from, to choose doctors, to choose hospitals and other providers. There's lots of different categories, such as special needs or Medicare savings accounts. These are very small categories. The main ones are health maintenance organization, which means mandatory network, and PPO, which means a preferred optional network that you can choose doctors if you want, or you can go outside the network. So HMO means mandatory, PPO means optional network. Very important to understand that. Now, if you've been paying attention to any advertising that's been happening this year and seen Joe Namath on TV and Jimmy Dynamite JJ Walker, they keep saying incessantly, get your extra Medicare benefits. This is what they're talking about. To make sense of this, these extra benefits are true, such as dental, vision, transportation benefits, hearing aids, meals, and over-the-counter medical items. These benefits are true, and Medicare funds these benefits. These benefits can be thousands of dollars a year of extra benefits, and there's a major imbalance going on in the Medicare system, and the government knows this. People say, well, wait a minute, why are all the extra benefits under the Advantage system and not under the Medigap traditional system? Well, if you understand what's going on with Congress, they're trying to pass a couple of big bills, and one of the bills has in it for regular Medicare, traditional Medicare, to include some of these benefits like dental, vision, and hearing aids. But that might not be till 2025, 2026, if it even gets passed. And so there's an imbalance. People say, I need these extra benefits, and you can only get them for free, generally for free, under the Medicare Advantage system. If you want to get those style of benefits under traditional Medicare, you have to pay extra money for them. And I understand why people feel that's unfair, but the government is working on fixing this. And it's true. When you hear on TV that you can get a lot of extra benefits at a zero premium, it's actually true. And it sounds like too good to be true, but it actually is true. And there are no pre-existing condition periods on this side of Medicare. There are no health questions. There are no, do you smoke or do you not smoke? Your height and weight, none of those questions. This side of Medicare, you can switch between plans every single year or when you move and not worry about answering any health questions. And that's another imbalance between the two systems. The traditional system still allows states to have it where people are answering health questions, whereas under the modernized system, there are no health questions. So people get confused by that. Now, these plans you can only change generally at the end of the year. The end of the year is October 1st for preview. Starting October 15th is when you can actually start enrolling up until December 7th. And we'll talk about that a little bit more. But if you're moving from Tennessee to Georgia or someplace, then you can also change your plan during that move or that transition. Important. There are rules, and that's why we help our clients all that time. The first initial enrollment period at the top of the screen here is when you're just turning 65. Well, if your parents are already beyond turning 65, they have different enrollment periods. But a normal person just turning 65 will do it around their birthday, and they can do it 3 months before they turn 65, the month they're 65, or 3 months after. But if your mom or dad is already 75 years old, there are different enrollment periods for them. Very important for you to understand that. So let's talk a little bit further about how do you make this decision between traditional Medicare versus the modernized system. And I really believe it's fairly simple if you don't overthink this. So under the traditional system, if you see at the top there, it says supplement, SUP, and underneath there it says the word prepay. And then down here on this block it says advantage, ADV, and it says pay as you go. Everything in life is this way. You can either pay now or pay later. You don't get a free refrigerator. You buy a warranty and then you get a free refrigerator. Or you just buy a refrigerator when you need to pay it, when you pay as you go. So this is what's going on with Medicare. If you buy an insurance policy called a supplement, you are paying an insurance company for them to say, don't worry about it. We've got your hospital bills. We've got your doctor bills covered. You pay for that privilege. Pay now. If you do an Advantage plan, you generally do not pay any money beyond your normal Medicare premium. You don't pay an additional money to an insurance company. It's probably a zero premium. 85% of the Advantage plans in the United States now are $0 per month because the government funds them at about $1,000 per month, and the insurance companies say to the clients, you don't need to pay us anything extra. So nothing's free. Somebody's paying for it, but you pay when you need care. So let's talk about how this works. Under a supplement, you can go to any doctor who accepts Medicare nationally. As long as that physician is willing to see you, they're taking new patients, which not every doctor is. But basically every hospital in Georgia takes Medicare, so you don't have much of a worry. Under the supplement system, these plans are going to be more expensive. You're going to spend between $100 and $200 per month. I meet some seniors that are in their 80s that are spending $300 or $400 per month. But the normal prices is between $100 to $200 per month. If your mom or dad is spending $300 or $400 a month, you really need to shop that price. That would be an inordinate amount of money. But you also need to buy a separate prescription plan. That's easy, and we'll go over how to do that. But when you go to the hospital, you know, not going to get any big bills. I'm not going to get thousands of dollars of bills. I'm going to have 100% coverage at the hospital, at the rehab facility. I'm going to be covered. Very important for budgeting to understand that. Now, to come down to this bottom line here, we'll talk about what happens under the Advantage system. Under the Advantage system, which half of my clients use, fantastic coverage. However, they have to choose doctors from their network, or they'll pay more money on a PPO plan to go outside of the network. But they can go to see any doctor that takes Medicare nationally if they're on a PPO program because it is open access. That means they can go in or out of network. But of course, you're going to get a better deal using the provider network. Really important. So if your mom or dad is moving here, you want to make sure that they have good access to physicians. Or if you're changing plans, don't buy a plan unless you've looked up the hospitals and the physicians for your circumstance to make sure. Now, these plans generally are $0 per month, but you're going to pay when you need care. You're going to pay copays, not deductibles. So you're not going to have 100% coverage. What you're going to pay is, a good example would be $300 a day that you're at the hospital. If you're in the hospital for a week, that's $2,000. But after that point, you're going to have 100% coverage. They might make you pay for 5, 6, or 7 days of a hospital stay. Doctor visits, you might pay $5 or $10 for the regular doctor, maybe $30 or $40 for the specialist, but those are copays. The plans tell you very clearly that you have a maximum risk out of your pocket, which means once you hit that risk, you don't have to pay any more money. So what that is around $7,500 is the national average. $7,500 doesn't mean that you go into the hospital and pay $7,500. It means that every time you pay a copay for your doctor visit or your emergency room or your hospital, they're going to add those numbers together. And if they ever hit $7,500, you're going to stop paying copays and you're going to be covered 100% for the rest of the year. Let me use myself as a perfect example. I broke my ankle in February. I slipped on some ice and broke my ankle. I have a normal health insurance plan with a $7,000 deductible. In order to get my simple little ankle surgery done, 20-minute surgery, cost me $7,000. Well, if I would have been under Medicare, I would have had much superior coverage because I would have gone in and said, my ankle is free. I would have prepaid for it, of course, but I'm paying $700 a month for my health insurance now. I would have much rather spent $200 a month and had a free ankle. Under the Advantage system, my ankle wouldn't have been free. It might have been $300 or $400. So even though there's a $7,500 risk on the plan, the whole ankle surgery might have been $400. The whole hospital stay might have been a $100,000 hospital stay, but you might have only paid $600 because you were there for 2 days. So be careful. There's a lot of bad actors out there that explain that these plans, they teach it incorrectly and say they have a $7,500 deductible, and that is not true. Okay? So now let's talk about a few things here. Medicare supplements. We have a flyer that you can download on this subject because this is one of the most important subjects when you're taking care of your parents, because the older crowd, 75 and up, a lot more of them have what are called Medicare supplements. And there should be a green sheet there. Amy, if you could grab her one of those, that would be nice, the green one, if I didn't put it out there. Okay. On the table there. This is important. This is where people get really confused, and it's not confusing. It's really very simple. The difference between what is called Plan F Medicare Supplement, which is the highest level of coverage, versus Plan G is basically very simple in that there's a small deductible. They're twin brothers. Both of these plans have identical coverage. Hospital coverage, outpatient coverage, doctor coverage, rehabilitation, blood, everything is identical except for one item, which is an annual deductible of $233. So people say, well, why would I want to get a plan with a deductible instead of a plan that has no deductible? Because you save so much money, that's why. If you go from Plan F costing $250 a month and you go to Plan G, which might be $175 a month, and you save $75 per month, which is over $800, right at $900 per year, it's easy to pay a $230 deductible. So the reason people do this is because they want to save money. Fixed income seniors are afraid to understand the difference between Plan F and Plan G, and the government has made it really, really simple. They're identical, twin brothers, except for a small deductible. And that's what this chart shows. I'm not going to go over through every item on this. It's one item that's different, and the premium. So if you want to save money and you can qualify, help your mom or dad reapply to get Plan G to save money. If they insist and say, no, I still want to have Plan F, they can do that. That's fine. And you can probably still shop and save money. The insurance companies love it when people don't do this, when they just sit on their plans, just like the cable companies love it. When you just keep on paying that bill, they keep raising it and raising it and raising it. That's what happens with these plans. And you need to be a smart consumer and say, no, let's try to get this down, just like you would do with your car insurance or your homeowner's insurance. Just call and shop the price. Now, every company can be different on price, but they can't be different on coverage. But every company can ask you different health questions. So I helped a lady last week who had breast cancer 2 years ago. It was about a week over her anniversary. One company would approve her, but another company asked, have you had breast cancer in the last 5 years? She would have had to say yes. But the other company said, have you had breast cancer in the last 2 years? She said no. She was approved. For a consumer to know those differences between those health questions is unbelievably frustrating, because you would have to know the application questions from every company. And unless you call and get a packet from every company, how are you going to know that? Well, my agency knows how to do that, and you find a professional agency, they're going to do that professionally for you. But if you call one company and apply, you're not going to know what their question is until they ask it to you. And so it can be very frustrating to try to shop this, because they won't tell you ahead of time, their questions and the detail on their questions. In some states, we don't have questions. It's just buy a new plan and sign here. But in Georgia, we do. So I get it, why the consumers are frustrated. Now, the biggest question that we have these days under Medicare is the cost of prescription drugs. The last 3 presidents have been talking about this. I mean, it went back all the way to George Bush II. And when he put in the drug program in 2005, it was to help seniors with their drug prices. But right away, drug prices have kept escalating and escalating. Insulin prices have been escalating. I was reading a report in the Atlanta Journal today how insulin in some countries is $9 or $10 a month, and here it's $90 in comparison, 10 times the cost. So we have a problem on drug prices in the United States. But the bigger problem right now for seniors is they don't understand their Medicare drug benefit. So there is a sheet that you can download. 2 sheets. The first one is how to create a Medicare account. Every senior that has Medicare should create a Medicare account, or their son or daughter should do this for them, because this is how you manage their Medicare. Once you create the account and have your login and password, this next flyer, which you can download, is about how easy it is to do a drug review. The government has massively improved this over the last 3 years. It used to be that you would have to type in your drugs or the drugs that your parent is using, and you have to choose it and do all this stuff. Not anymore. Every time they're filling their drug at the pharmacy, it now is being reported into the Medicare account. So you just go in there and it says, these are the drugs we see that you're using. Check off if you want to continue to use these drugs, and tell us your pharmacy. And you put in the pharmacy and you hit go. And it tells you right away, there are 25 drug plans in every county in Georgia. And you're like, who the heck wants to look at 25 drug plans? You don't. Medicare says, forget it. Here's your current plan, and here's the plan you need to be on. It shows you right away, and it'll say, next year your drugs are going to cost $2,000 on your current plan. If you would just change to the next plan, the correct plan for you, your drugs will be $1,000. It really is that simple. But seniors are not doing it. 90% of seniors are not doing a drug review, or their families aren't helping them. There's not enough government resources to help everybody do this, so they've improved the Medicare website. You would think if they build it, they would come, but that's unfortunately not happening. You need to do this with your parents. Now, this drug program has been improved many times over the last 15 years. It's improved in 2010, again improved in 2020, and it's going to be improved again soon. They're talking about dropping the cost of prescriptions, the ultimate cost of prescriptions for high users by a third. So they're really working on some neat ideas right now. We'll see. But the biggest problem that people have hated about the donut hole, the Medicare drug program, is something called the donut hole. So let me explain what that means. That was back in 2005 to 2010, was a time period in the Medicare drug program where there was no coverage. And people were furious. So from 2011 till 2020, they shrank that problem down by 75%. So it used to be at a certain point you had no coverage. Now you have 75% coverage. So the government has listened and the government has improved this quite a bit. So if you're hearing something from your mom or dad about some massive problem they had 10 years ago, it's probably not a problem today. The problem is they're probably on the wrong drug plan. So here's how confusing this can be for seniors. And this is why people tune out and turn off this information. Because the government says some plans have deductibles. Every plan has initial bucket of money of $4,430. Well, what does that mean? And every plan has what used to be a bad donut hole. Now it's 25% coverage. And every plan has a $7,050 risk. If you taught this to most seniors, they're going to say, forget it. I stopped doing school a long time ago. This is crazy. And then there is a catastrophic period, which is 95% drug coverage. So this is a lot for people to take in. Try not to memorize this, and instead, do the 10 easy steps to review your drugs. Okay? You don't want to learn how a tire is built. You just want to know, is this the right tire for my car, and is it going to keep me safe? By doing this correctly, by logging into your Medicare account, you make sure that your drugs are in there. You put in how many times you're using them. If you're doing 90-day supplies, you put in your pharmacy, and immediately it helps you compare up to 3 plans together. You don't have to compare 3 plans. You can just look at your current plan versus the correct plan. The average error for people doing this, the average error Medicare has found, this was 5 years ago, was $720. I estimate the average error now is over 1,000. I do hundreds of these drug reviews a year, and I see it all the time where somebody is wasting $80 or $90 per month. A drug plan that might have been good 5 years ago and it was $19 a month premium, today might be $89 per month. That is crazy. And the reason that happens is the insurance companies know that the seniors aren't paying attention. It's being deducted out of their Social Security check, and they don't have any idea, and the families certainly don't know that the insurance companies have raised their rates ridiculously. I had a plan last year that was $20 per month, and in 1 year became $89. In 1 year. We called all of our clients and moved them off of that plan. But that happened with about 5 different companies where they just jacked up costs. And you need to be a good consumer and not get tripped up by this. Now, some people like to learn visually. So we have our YouTube channel where you can actually look at a 1-minute YouTube video on how to do this. Very simple. We do this for our clients. You can also call Georgia Cares, which is a state agency that'll do this for you also. But you need to keep your list of drugs correct on your Medicare site. They should also be reporting it in there. But the average error, this was 5 years ago, and they've not updated the study yet, was $720. That's $60 a month. So your premium might be wrong by $20 or $30 per month, and your drug prices might be wrong by $20 or $30 a month. And now all of a sudden, that's $720 for the year. This is how easy it is. And remember, $720 out of your pocket is $720 in the insurance company's pocket. Big profits. Keep them from taking that money from you. Okay? So let's talk about enrollment periods, because when you're helping your parent, you need to be aware, hey, when October comes around, that is an important period of time. Also, when they're turning 65, it's important. But if they're beyond that, that's the annual election period is October 15th to December 7th. And the reason they choose December 7th is so that they get the applications in, and that gives the insurance companies 3 weeks to print your ID card and put them in the mail to you. Unfortunately, the U.S. mail has been running slow, but that gives them 3 weeks to get your ID card to you so you can start using it January 1st. I used to have to work on New Year's Eve helping people out, and I'm glad they've changed it to December 7th. But let's go back to the start here. Initial election period is when you're turning 65. The special election is for people who have a special circumstance such as moving. If you're moving from state to state or county to county, you can manage your Medicare. If you lose other coverage like employment insurance or retirement insurance or other benefits, that is a special election. And there's also certain special elections that happen depending on weather. If it's a snowstorm or a hurricane, typically the government gives us special election periods to help people manage their Medicare. Well, what did we just have? We're in the middle of a worldwide pandemic. They gave us special rules to help people that are being affected by the pandemic. But there was even other things that happened during this last couple years, such as peaceful protest. So if you were affected by civil unrest, there were in certain counties and certain cities, they gave us special rules to help people manage their Medicare because they were impacted by things that weren't their fault. So for a consumer to understand these special elections is hard. Even when you call into Medicare, they don't always know their own special elections. It's frustrating. The annual election period is at the end of the year, and on October 1st, we can start previewing to help people out even before the annual election period. But this is a new one. This last one right here is the Advantage election period. We call this a Medicare mulligan because if you're on a Medicare HMO or PPO, the modern side of Medicare, and all of a sudden you go into the doctor in January and find out, oh no, my doctor's not covered anymore, or my hospital where I was getting my cancer treatments aren't being covered anymore, you get a one-time fix during January, February, and March to fix your Medicare because you failed to check it during October or November, and you're like, oh no, I'm stuck. People used to be stuck for the entire year. Now Medicare says, no, we're going to give you relief. You can make a one-time change during January, February, and March. Now, what is crazy about this is I'm not allowed to tell my own clients about this period. They have to know it on their own and call my office. So you need to tell your friends, you need to tell your mom and dad, hey, I think we can fix the Medicare. If it's in January, February, or March, let's fix this so that we're not spending extra money and we got your doctor covered, we get your cancer treatments covered. This is huge. This started 2 years ago. And people don't know about it. It's on the 3rd page of your Medicare and You book that nobody reads, okay? So these are these special election periods. Again, let's talk about it. You can be losing employer coverage. You can be moving. You can have a special life event like a death or a marriage or losing or gaining Medicaid. Medicaid is for low-income people. So these special life events. Or if you're total low income or special needs, they also give you not just one time a year, they'll let you do it all 4 quarters of the year. You can make a change each 3 months, January, February, March, each quarter you can make a change. And that is for low income or special needs people that have diabetes, kidney problems, or heart, lung problems, cardiovascular issues. So each state has different low income and special needs programs. We've got some really good ones here in Georgia. We're very lucky. But remember, for you to try to study this and understand special election periods is probably not going to happen. Just find a professional agency or call Medicare to say, hey, I've got this circumstance. Which one of these things is going to apply to me? And sometimes it's multiple things. Sometimes I'll say to someone, well, you know what? There was a hurricane in your county, and I know you didn't get destroyed by it, but it was actually part of the county list. We can actually fix your Medicare because you're on the list of counties that were affected by that hurricane. Or, hey, you also moved, and because you moved, we can do certain things. So it's really important that you understand this, but moving is interesting because sometimes people will move and they'll forget to tell the government that they've moved. They'll forget to tell their insurance company that they've moved. So when you move, you need to tell Social Security, I'm not in Knoxville, Tennessee anymore. I'm now in Lawrenceville, Georgia. And they'll update your file. Well, then that'll then create an effect to tell your insurance company, hey, this person's moved outside of your service area. They need a new drug plan, or they need a new Advantage HMO or PPO plan. And you'll get a letter that says, hey, we heard you moved and you've got to make some management on your Medicare. You got to take care of this in the next 60 days. So that's really good. And a lot of times people will call me and say, well, Mom moved here, a while ago. And I'll say, did you ever call the government? No. All right, let's get that process going. Let's fix this. And really can be helpful to do the change at that moment. So let me give you an applicable scenario. This is very typical, and I like to use moving as a perfect example because a lot of people are moving back from Florida to Georgia and moving to be near their families. Well, Grandpa Ted moves from Florida. And the reason he moves from Florida is he's got declining health. He had a stroke. And so poor Grandpa Ted, he can't take care of himself anymore. He's going to move to be near his son and daughter. So Grandpa Ted comes here and he gets a new assisted living facility that's down the street from the neighborhood where his family lives. And the assisted living facility says, hey, Grandpa Ted, we need to cancel your plan because it doesn't work here. And they give him improper advice. So Grandpa Ted loses his Medicare rights and can no longer use his special election period to properly manage his Medicare. The assisted living facility thought they were being helpful, and instead they create more problems. So I actually teach those people how not to be inadvertently causing more issues. So what Grandpa Ted should have done, Grandpa Ted should have used his Medicare rights. He should have called his Social Security, called his companies, and said, hey, I'm moving. And then he would be guaranteed the correct plans that he needs for his facility. I've had this happen with insurance companies where people will call the insurance company and they'll say, hey, we've got a nice Medicare plan just like what you had in Knoxville. We got a very similar plan in Gwinnett. Let's just move you to that plan. And they don't tell the family that there are multiple departments at that insurance company that handle many Medicare plans, and they don't tell him about all of the options that are available to him. And that happens. I had a TV newscaster here in Atlanta that told me that's exactly what happened to him. His mom moved from Chicago here, and he says, I called the company. They're the largest company in America, and they just moved her to a new plan. It cost him about $4,000 or $5,000 a year in mistakes. He was crazy about it. He said, if I was still a newscaster, he had retired. He says, I would be putting this on the news because it was so bad. So the right thing to do is to use the rights correctly, do a proper review, use the Medicare website, choose the right plans, find the right options, and look at all of them. It might take an hour for us to do that for one of our clients. For an individual to do that, it might take you a few hours trying to learn it on your own, but it's really not a painful process if you know what you're doing. It's just a proper process. And once we do that, then every year you can also manage your Medicare by understanding the annual enrollment periods. But this happens all the time. People will move from DeKalb County over to Cherokee County, and the assisted living facilities or wherever they're living will screw them up. I see it all the time. It's one of my most common scenarios. All right, Medicare.gov. This is the green sheet that I was showing you of how to create your Medicare account. And everybody should do this. Just like you have your login for your bank, your login for other things, you need one for both your Social Security account and separately one for your Medicare account. And keep those passwords. It's very important. The Medicare account, you have to use your Medicare ID number, and you're able to create that login and password, and you're going to manage your account. If you ever lose your Medicare card, you can print out a temporary replacement and you can order new cards. You can see all the in-force status. So if you're like, I don't know what mom has, and you can look right in the Medicare account. It says, this is what your mom has. She's got, this company for her supplement and this company for her drug plan. It'll say it. Also show you her prior coverage. So if you're getting bills from doctors that say, hey, these things aren't being paid, you could say, wait a minute, Mr. Provider, you're billing the wrong place. My mom's under a new plan now. Why are you billing her old plan? You can look at claims and see if claims have been paid. So if you're getting some bill from an ambulance company, you can actually go print off to see, hey, you guys were paid. Quit bothering me. Quit sending us collection notices. It shows right here on my Medicare account that you were paid. And so this is a very empowering thing to have. But you can also analyze and select all of your new plans every fall there, or if you're moving or having other circumstances happen. This is important. And I think it's like 10% of people have created a Medicare account. Maybe we're lucky and it's 15% at this point, but everybody should do this. And people don't realize how valuable they can be in a time of crisis. I'll have families all the time will call me up and say, Keith, my dad was great and then he had a stroke and I've got to step in and take care of all this stuff. And I don't even know what drugs he's taking. Well, if you go right into the Medicare account, there it'll show all the drugs he's been taking. Even though he might have 20 different pill bottles, because seniors tend to not throw away drugs, and they'll have a whole bunch of them in there, and some of them will be a year old, 2 years old. Well, you'll see the current ones they've been filling, and you can dispose of all the ones they shouldn't have in their medicine cabinet, and it's bad. The fire department and other places will take those old drugs and destroy them properly. Okay? Now, when you go to the Medicare website, it's really simple. You'll click on the main screen where it says log in or create account. And it's very simple. You put in your Medicare number, you put in your last name, your email address, confirm the email address, and then put in date of birth and zip code and the date that your Medicare started. This will take you 30 seconds. It's super simple. And once you do that, you'll then be able to create your login and password and write that down, keep those, it's important. But when you go in there, you can view your claims. You can actually pay your Medicare premiums if you need to. If your mom or dad's not taking Social Security, they're paying their premiums. If somebody's taking Social Security, the government just grabs it out of their check. They can print the drug list and update them, print a Medicare card, manage the account, and find Medicare providers. This was not this good 3 years ago. It's been a massive improvement. I'm very proud of the government over the last 3 years of actually doing some fantastic improvements. Okay, so let's also talk about some other things that are elder law issues beyond Medicare that you need to deal with when you're dealing with your aging parent. You need to definitely find an attorney that deals with elder law and deals with advance directives, which will help you in case of emergencies, healthcare proxies, durable medical power of attorney, living wills, and other issues. You need to do this if you're starting to take care of your parent. You need to make sure that their wills are updated and any directives. You need to find an elder law attorney that deals with this, not just an attorney who does trusts or wills. Find a true elder law attorney. Also find out if your mom or dad has long-term care insurance. This will pay for assisted living or at-home care, such as personal needs for dressing, bathing, cooking, cleaning, going to the bathroom, etc. These are important things on making sure that you're taking care of your parents, because Medicare does not take care of long-term care. Medicare does not provide advance directives. Medicare does not do these things. And people assume that Medicare pays for these stuff, and it does not. So don't make that false assumption. You need to make sure that your mom or dad has the proper documents in place so that the doctors can do what you need to have done for your parent. But also, Medicare does not pay for assisted living centers, does not pay for someone to come bathe or clean or dress someone, does not do that. You need to make sure that you're covered. If you're a veteran, you do have some veterans benefits that'll help with that. Or if you're a spouse of a veteran, you can have some extra coverage there called aid and attendance. This is very important. Don't assume that Medicare covers these items. Okay? So Medicare, of course, doesn't cover everything. The next thing that it doesn't always cover is dental. Under a lot of the new plans, the dental is included, but it doesn't mean it's going to be included the next year. That's an optional feature that Medicare does not mandate yet. It might be mandated in a few years. So if you want permanent dental coverage, you'll need to buy your own dental insurance plan. Of course, Medicare covers critical events, such as heart attack, stroke, and cancer, but Medicare does not pay to have your bathroom rebuilt to help you after a stroke. So a lot of people buy additional coverage like the duck you see on TV and those additional coverages because they might have $20,000 or $30,000 worth of extra bills surrounding a major medical event. Medicare doesn't cover anything except the medical bills themselves. Medicare does not pay to bury you. So if you want to have your own life insurance, that's fine. You can do that. The Medicare does not pay for your burial, so you would want to take care of that yourself. But the big one, the biggest one that people get problems with is home care or assisted living facilities. Medicare does not pay for custodial care. It pays for skilled nursing care. So you have 20 days for free of skilled nursing care if you qualify, plus another 80 days at a fee. So that's a total of 100 if you qualify. It's not guaranteed that you're going to get this. And so if you're at a skilled nursing facility and they approve for you to have 8 days of skilled nursing, after that point, you're going to be paying a daily or hourly fee for your parents to have this care because Medicare stops paying. People make a false assumption on this category more than any other. Be very, very careful about that. Low income. I have another sheet that you can download for low-income individuals. This sheet is all chock full of social services for helping seniors, including the National Council on Aging website and other information. Nothing about my agency, of course. But the big one that's on this sheet is the one from Social Security that is called low-income subsidy or extra help. The extra help program is where the government said, look, we know that some people can't afford to have a drug plan, so why don't we pay for it for them so that they can get their drugs? And then somebody said, well, wait a minute, just because you give them a free plan doesn't mean they can afford their drugs. So there's two levels. They can pay for your drug plan for you, some or all of it. And then at the pharmacy, when you go to pick up your drugs, if you're low income enough, the most you'll pay for generics is $3.95, and the most you'll pay for brand name drugs is $9.85, or 5% for certain drugs. Think about this. Somebody's paying $200 a month for their insulin, and all of a sudden it becomes $9.85. This is a huge benefit, and 20% of seniors who should be getting this benefit have failed to either apply or they were turned down and they failed to reapply. So you might get turned down because you have certain assets and things they ask questions about, but as you spend those assets, you might then reapply and be approved. So you can apply every year or anytime a major thing happens. Let's say you lose a spouse, lose half your income, reapply for low income subsidy and go to the Social Security website to do that, ssa.gov. But this is what's even better on top of there. All these other junk in the Medicare drug program is eliminated. No more deductible for the people. No more donut hole. You don't have to worry. You just have to pay your normal prices for your drugs. And a lot of times the generics aren't even $4. A lot of times they're $1 or 50 cents. But boy, if you're on a brand name drug, this is a massive savings. If you go from $100, $200 a month to $9, it can be huge for a fixed income, low income senior. So if you know anybody that's suffering from drug cost or prices, they need to apply for extra help, okay? So sometimes though, people won't get approved for the extra help. So high cost medications oftentimes have what are called patient assistance programs. These programs, PAP, patient assistance programs, are oftentimes set up by the pharmaceutical companies. And when you have a brand new drug that comes out and that drug is, $5,000 a month or $50,000 a month, like some of the ones they've talked about recently, who can afford that? So in order to get the drug going, they'll set up these assistance programs, they'll put some funding in there, and you have to apply for it. Sometimes it's tied to your income, but oftentimes it's tied to your condition. If it's a kidney condition, if it's a mental health condition, if it's a cancer condition. So look for patient assistance programs. If you are seeing a doctor that specializes in your certain thing, the doctors oftentimes know about these assistance programs and will help the clients find those. I know Emory University does a really good job of this with their cancer patients and other special needs patients. But there's also a lot of drug cards that seniors are mailed, or they see advertised on TV that'll provide little discount savings cards for drugs. And this is fine. A lot of times they work. You need to talk to the pharmacist, because your Medicare plan might cover a drug and say, look, it's $40 for this drug. And you might find it with a discount card for $12. It's okay. You can buy drugs away from your Medicare plan. The problem is you're not going to get credit for that drug. If you buy that drug through a discount card, they're not going to report it to Medicare. It doesn't match up. But it might be okay for you to do that. Just talk to your pharmacist before you just run off buying everything through a discount card, okay? Be careful. Some of them are scams. There are several good ones out there. And definitely don't give somebody your Medicare information over the phone. If they call you and say, I can save you money on your drugs, don't give them your Medicare information over the phone. Talk to your pharmacist. All right? Now, this is where people make a lot of mistakes. People are taking COBRA, and it creates a financial penalty instead of taking Medicare. What happens is COBRA is not considered creditable coverage. COBRA means you have left the job and they're continuing your benefits from the job, and or if your spouse dies and the other spouse gets COBRA for 30 months or so, they should be going into Medicare, because COBRA is secondary to Medicare. Medicare is primary, and it creates a penalty under your outpatient portion of Medicare called Part B, which is a lifetime penalty, and it might also create a penalty under Part D, which is a drug plan. The drug plans, though, oftentimes people have penalties on the drug plans because they'll say, well, I don't need drug coverage. Mom doesn't take any drugs. We're just going to drop that. If you go without drug coverage and then you sign up for drug coverage later, there's a calculation of about 33 cents per month that they add up, compound that up. So if you go for 2 or 3 years without drug coverage, you might end up with a $15 a month penalty the rest of your life. So it's better to shop for the right drug plan than to drop drug coverage. The next thing is that high income earners or high income incidences will create higher Medicare premiums. And so let's talk about a high income incident. Mom or dad fall into different health. They sell their primary home, which is fine. There's no taxes on most of that. Up to $500,000, no taxes. But maybe they also sell the cabin or the beach house. Well, that is a capital gain, and it'll show up on their tax return as all of a sudden mom or dad is this big high income earner, and 2 years later, Medicare informs you, we're going to jack up your Medicare premiums. Well, if you're not always a high income earner, you can appeal that and get that probably taken off, that penalty. And the way that you know if you're getting that penalty, it's called IRMAA, I-R-M-A-A, is you look on their Social Security statement. So if they're not paying the normal Medicare premium of $170 per month, and instead are paying $300 a month, you need to appeal the surcharge for high income, because it may not be them. They may be a regular income person, but maybe they just had a big year in the stock market, or they sold some property or something. Low income people don't have to worry about these penalties. The government is going to assist low income people and not penalize them. So when somebody gets approved for the low income plans, all of these penalties drop off. So some people will come to me and say, well, my mom's never had a drug plan. She's really poor. She's never had one, but we don't want to have one because she's going to have a giant penalty. And I say, no, let's get her approved under the subsidy program, and you don't have to worry about that. And the people don't understand how the rules work, but low income people don't get penalized, okay? So why do annual reviews matter? There's another sheet that you can download that is concerning why annual reviews matter. And this is hugely important, okay? This is in October. You need to do this. So think about it. If Labor Day comes around in September, put it on your calendar. I need to do an annual review for my parents' Medicare. You must make sure that their drugs and pharmacy are covered. I've had this happen many, many times where somebody will come in and say, Keith, this drug plan stinks. It used to be $10 a month for my drugs, and now it's $40 a month. And I'll say, well, wait a minute. They sent you a note back in October that CVS is the primary pharmacy now, not Walgreens. Why are you still going to Walgreens? Well, I didn't read that note. Yeah, that's the problem. You didn't open the mail. And so sometimes people just are going to the wrong pharmacy, but sometimes their drugs are just priced completely wrong, bizarrely wrong. We see crazy things. You want to make sure that your doctor and hospital are covered next year. Talk to your doctor. Say, hey, you want to make sure you guys aren't dropping out of any network or anything. I want to make sure everything's fine. Check the plan list and make sure the doctors and hospitals are there. Here in Atlanta, we've had two major battles between two different hospital systems and major insurance companies this year. I got a lot of phone calls from clients worried. Look, my wife's got this surgery scheduled and this hospital is battling with this insurance company, and we have to put their mind at ease and make sure that they're fine. You must make sure that you're not being overcharged. This is the most constant problem. The insurance companies love it. Overcharging you means increased profits to them. So don't be overcharged, okay? Very common. And it is bizarre. On one company, they might have 3 plans. And one plan will be $50 a month, and it's no better than the other option they have at $12 a month. But all these people will be on the $50 a month plan thinking it's a better option, and it's not. All the time. It's really, really a lot of confusion there. You need to be advised on new Medicare rules. Every year, there are changes. Deductible changes, premium changes, penalty calculations, and the Medicare rules change generally once a year. And we get those rules. You can also look them up at the Medicare website. But this can really be important. It really was for insulin-dependent diabetics. The last president created a program called the Insulin Savings Plan, or Senior Savings Option, and it never made the news. It is crazy. People's insulin that they were spending $200 a month came down to $35 a month, but you had to choose the right plan that covered your insulin. So if you were on Humalog, maybe you needed to switch to Novolog. Maybe you needed to go from Basaglar to Novolin. And the consumers had no idea how to do this, but it was a giant first step of helping people save money on their insulin. But nobody on the news told anybody about it. It was crazy. It was the biggest improvement under the Medicare drug program ever. And it did not make the news. So we've really helped out people on insulin save a ton of money, a huge amount of money. Had one gentleman, it was $4,000 of savings for this year on his insulin. And he was in tears because he said, I can pay off my credit card now. You need to tell your Medicare helper, whoever you're using, about any upcoming life events. Are you going to be switching from one assisted living facility to another one? We had a lot of people during COVID moving out of facilities. You need to tell people about those life events. If somebody is dying, we need to know it. If somebody has lost a spouse, somebody had some other issues, you need to share those events because that can really impact their Medicare choices. So this is the name of my company, it's Affordable Medicare Solutions. We're in Suwanee, Georgia, but we provide a lot of free Medicare advice. And our whole goal is to make sure that consumers are empowered, they can do these things themselves, or they can ask for help. Thank you very much.